Insulin resistance can negatively impact your fertility in three major ways. Every week, I diagnose people in my practice with insulin resistance, and I'm going to bet many of you watching this may have it and not even realize it. So I want to break this down for you and explain how it could be hurting your fertility and what you can do about it. So first of all, what is insulin resistance? Normally, insulin is a hormone, and it acts like a key that unlocks your cells so that sugar from your bloodstream can get in and be used to make energy. When you're insulin resistant, your cells don't respond as well to that signal. And to compensate, your body pumps out more insulin to try to get your body to do its job. Some telltale signs of insulin resistance include weight gain, particularly around your midsection. So when patients say, I'm having a hard time losing weight, this could be an indicator. A strong family history of type 2 diabetes or metabolic syndrome in general, as well as lab tests like an elevated hemoglobin A1C or elevated levels of androgens in the blood work, such as testosterone or DHEAS. Women with PCOS are at particularly high risk of insulin resistance. Now, insulin isn't just about blood sugar. There's a major fertility connection that you need to know about. It acts like a growth factor on the ovaries and can directly influence hormone production from the ovaries and the eggs as they mature. So when levels are chronically high as a response to insulin resistance, things with your fertility can go off track in three major ways. So first, irregular ovulation. If you have high insulin levels, this can interrupt the delicate communication between your pituitary gland in your brain and the ovaries that are supposed to trigger ovulation. And this can result in cycles that are irregular, unpredictable, where an egg isn't released at all. And if you're not ovulating, you're not in the game. It can become much more difficult and inefficient to try to conceive. Insulin resistance can also impact egg quality. So that's mechanism number 2. We know that insulin resistance can actually cause the ovaries to overproduce testosterone and androgens relative to the other hormones that it normally produces, like estrogen and progesterone. And this imbalance can alter the ovarian microenvironment where the eggs are maturing. Eggs developing under these conditions may be more error prone when the chromosomes are being divided and rearranged during maturation, ovulation, and fertilization. And this can increase the risk of having embryos develop from those eggs that have quality issues. And mechanism number 3 is inflammation. Insulin resistance doesn't just affect the ovaries. It can create a low-grade inflammatory state throughout your whole body. And in the uterus, this can reduce how receptive the lining is to an embryo that's trying to implant. It may also contribute to some cases of recurrent pregnancy loss because the environment may not be as supportive as it needs to be for a pregnancy to continue to grow. So when we talk about insulin resistance, we're not just concerned about your metabolism or risk of diabetes. It's a major fertility issue as well. The good news is that there are concrete steps that you can take to improve your sensitivity to insulin and therefore your chances of conceiving if this is a problem for you. Check out my caption for my top evidence-based tips from lifestyle shifts to medical management.